HIV, does it have a cure? This video will tell you much about this. I will tell you what they call HIV. It's a virus, a human immunodeficiency virus. That microorganisms, that brings down human immunity. This can be sexually transmitted. Our video is not going into definition and mode of transmission and so on. But I am going straight to it. Everyone in the world knows about HIV/AIDS. AIDS as a disease and HIV as a virus. Ladies and gentlemen, remember there are several types of microorganisms that cause disease. Viruses are one of such microorganisms. You have bacteria. Apart from viruses, you have bacteria. You have fungi. You have protozoa. You have rickets, and parasites. They are microorganisms that cause disease. But this time, in this video, we are very specific on a particular virus. There are equally different types of viral diseases, that is, different types of infections or diseases caused by viruses. HIV is one of such viruses. Remember, you also have something like hepatitis B is also a virus that is causing it, and it is also sexually transmitted or transmissible. You also have something like cervical cancer that is caused by human, papilloma virus. Remember, it's still a virus. You also have the vulva, warts and so on. There are different types of viruses. But I come back. Can HIV/AIDS be cured? My name is Dr. David Ayin. I'm in Bamenda, Cameroon. You're a reproductive health expert and, coordinating the understanding of very, interesting reproductive health topics on this reproductive health channel, Dr. David Reproductive Health. You are welcome. If you have not subscribed, please subscribe, like, and share. Now let's get to this. There is no cure for HIV yet. At least not confirmed, not proven. We know a lot of people speak about curing, meaning that completely eradicating, the virus from the system. Meaning say, herbs, herbal medicine, traditional medicine, cures. We do not have any direct proof. The World Health Organization has not brought any direct cure. But then there are drugs, there are medicines that are used to treat cases of HIV/AIDS. This condition is treated with antiretroviral drugs, which stop the virus from growing, from multiplying, from replicating, in the body. When they talk of multiplying, replicating, is like giving birth. A virus can multiply into 2 and then multiply into 4 and could grow to double to 8, from 8 to 16. And if the virus finds itself in your bloodstream, which is a very favorable place for it, and it is sucking in your white blood cell and growing, you will see that the more the number of the viruses increase, the more the system, the body is affected. The drugs allow the immune system to get stronger, okay, helping the system to get, to fight against other infections. Those type of infections that we refer to them as opportunistic. Opportunistic because when the HIV deals with the immune system, when the HIV breaks down the immunity, that is the ability of the human body, the human system to fight disease, to defend itself and maintain good health. That is referred to your immunity. When this ability to fight disease is weakened, a virus enters your system, it weakens this because they keep growing in their numbers to break down your immune system. You will now notice that the least mistake, you get sick. You contract different types of infections, especially sexually transmissible infections. Before they know you're suffering from syphilis, before they know you're suffering from chlamydia or gonorrhea or other even more severe disease conditions or other viral conditions, okay? Because when immunity is low, any form of disease can easily attack the system because your system doesn't have the ability to fight back. But nature has made human body capable enough to fight disease. That ability is in the immune system. If HIV multiplies in your system, HIV can easily break down the system, and different types of infections or diseases may now affect you, and you may now be dying of opportunistic diseases that are now taking the opportunity that the immune system is low and coming. Antiretrovirals are taken, as we say, they are drugs, they are medicines they use to treat HIV/AIDS. They are taken every day for the rest of the patient's or the client's life. Why? Because it doesn't completely cure, it doesn't completely kill. But what does it do? It prevents, as we say, the virus from growing, from multiplying. So if at the time they have discovered that you have HIV, let me just take layman term to say that the viruses are 100 at the time they have discovered that you have HIV. They can put you on antiretroviral drugs so that they maintain the level 100 and then be reducing, because the cells are certainly also living their lifespan, and then some cells are breaking down and dying. When the drugs actually arrest and prevent multiplication, replication of the cells, then your immune system cannot be broken down because the virus is not growing. It will not easily cause you problem. Now, this drug, as I say, and I'm repeating, actually lowers the amount of virus in the person's body. When the level of the virus is low, this stops the symptoms. The person is bound to live healthily, and you are dealing with the person in the quarter, in the village, in your country meeting, in church, in whatever, and there's nothing physically to tell you that this person is not well. There's nothing physically to tell you that this person is sick. She has enough strength. She goes to the farm, she goes to the job site, she does all kind of, technicians are doing their work, they come back, they cook food, they still get married, they still get pregnant, they give birth to children, yet they are HIV positive. This is the good that the drugs do. This is where the nectar, the effect of the drugs is felt. A lot of people who are living now, who are HIV positive, do not have any sign. They do not have any symptoms because they have been taking their antiretroviral drugs and they have completely put the virus under control. It's like they are paralyzed by the virus. And virus cannot harm them again. It cannot stop their body from growing. You see, a lot of them grow fat. They put enough weight and look healthy and smart. Reason for which we still tell our public, take all precautions to stay away from getting yourself infected, from contracting HIV. HIV does not show on the face. A man may be very handsome, very active, very smart. You know, some people say, I like hard-working man. And he's there working every day tirelessly. And you just love the man for the fact that he's student. That is not enough to go in for sex without protection. Because you will not see sign of HIV on the face. You will not see in the body. He may be very handsome. He may even be more handsome than he had always been. He may even be a very prominent person in your community. HIV doesn't know president. It doesn't know director. It doesn't know doctor. It doesn't know lawyer. It doesn't know the pastor. It doesn't know anything. As far as you're human, if you expose yourself, you can get infected. My cry here is, there are drugs, there are medicines. They are called antiretroviral drugs. They are everywhere. Go to the health center in your village. Go to the health post. Go to the hospitals. Go anywhere. Which town you find yourself, which country you find yourself, go to the hospital. It is even good you just decide to go and do the test, the screening for HIV. If you discover that you are positive, relax. Also thank God for early diagnosis. Because early diagnosis is the key, my dear brother. You will not die. You will still live a full life. You know, in most books they describe such life as near normal. Yeah, normal, because near normal, because you are on drugs. And once you get used to it, it doesn't disturb you, even psychologically. And it can actually put the virus under control. And a woman can actually get married. Even a man can actually get married. Making babies, yet not contaminating, not infecting the partner. It is possible. Go to the hospital. Your doctor in any country is going to show you how. Why? You know, during pregnancy, the women, some women get pregnant and they only come for antenatal care. In the course of some laboratory screening, HIV is one of them. And some of them are detected at that time that they are positive. And as soon as they detect them, they always put them on drugs, on antiretrovirals. And it treats well because it keeps these women healthy, you know, maintaining their immune system, preventing the transmission of the disease to the unborn baby that is in the womb. And then you must remember that once a woman is pregnant and she's HIV positive, she could transmit this virus to her baby in the womb during pregnancy or during labor or during delivery or during breastfeeding, because the virus can pass through milk, breast milk, as you're breastfeeding the baby. But they can treat it until both mother and baby are healthy. Go to the hospital and you will see how possible this is. Therefore, HIV can actually be put under control and the community remains healthy and strong and live even with the virus. If you like to talk with me one-on-one, please call the number +237 694 353141. Thank you. But you can always only write messages or voicemail. Please don't call. When you send your messages, we'll get them. Thank you. God bless you. Bye-bye.